Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Here we're going to compare the heparin. So let's compare heparin with that of the LMWH versus that of the Fondaoarinux. So first we start with the heparin, that is unfractionated heparin. So here in unfractionated heparin, the structure is it is a glycosaminoglycan. We call it as a GAG, and it consists of the long saccharides. So it contains the long saccharides which are present. Next, is it having a factor XA inhibitor, 10A inhibitor, as well as we talk about the 2A inhibition. So the answer to both of them is there inhibition? The answer is yes, there is inhibition. So all this is about the heparin. Next, moving on, what about the bioavailability? So in case of the bioavailability, the oral. So we have oral, we have SC as well as the IV. So in case of oral, it is not absorbed, and in case of subcutaneous, it is not good, and IV is going to be good. So this is all about the unfractionated heparin. Next, moving on to the variable responses. So does it have a variable response? So variable response, we also call it as a VR. So in variable response, the answer is yes, it has a variable response. Then talking about the metabolism, it is cleared by the RES system. So RES stands for the reticuloendothelial system. Then safety in the renal disease. Is it safe in renal disease? The answer is yes, it is safe. And monitoring is what is required in case of monitoring. So in case of monitoring, we have the APTT, which is required for monitoring. And protamine sulfate antidote, this has a full reversal. It has a full reversal. Next, moving on to the risk of heparin-induced thrombocytopenia. So heparin-induced thrombocytopenia is nothing but the HIT. So is there a risk? The answer is yes, there is high risk. Then moving on to the risk of osteoporosis, we call it as the OP. Osteoporosis, the answer again, it is occasional, but it is maybe present. So this was about the unfractionated heparin. Next, moving on to the LMWH. So LMWH, as we know, is a low molecular weight heparin. So here again, it is a GAG, that is the glycosaminoglycans, and it contains a short. So there is a short saccharide chains. So there is presence of the short saccharide chains. And then talking about the inhibition of the 10A as well as the 2A inhibition, the answer here is yes, it has a 10A as well as a 2A inhibition. Yes, there is inhibition. Next is, what about the question on the bioavailability? So here in bioavailability, in case of oral, it is not absorbed, and in case of the subcutaneous, it is going to be good. Then moving on to the VR. VR stands for the variable response. So here in variable response, is there a variable response? The answer is no in case of the LMWH. And the metabolism is, in case of the unfractionated heparin, it was cleared by the reticuloendothelial system, whereas here in case of heparin, it is cleared by the kidneys. And what about the safety in renal disease? So in case of renal disease, it is used for close monitoring. There is close monitoring is done. Next is we look at the monitoring. So what is done in case of monitoring? So let's look at in case of monitoring. So in case of monitoring, it is required only in the renal impairment. So it is required in case of the renal impairment, and this is with the anti-factor 10A assay. So anti-factor 10A assay. So there's renal impairment with the anti-factor 10A assay. Next is we have the protamine sulfate antidote. So there is something known as a protamine sulfate antidote. There is a partial reversal, whereas in case of the unfractionated heparin, there was a full reversal. Here is going to be a partial reversal. And the monitoring in case of unfractionated heparin was APTT. Here it is the required in renal impairment with the anti-factor 10A assay. So next comes the risk of osteoporosis as well as the heparin-induced thrombocytopenia. So risk of HIT, as well as the osteoporosis. So here the answer is it is a bit lower. Lastly, we look at the Fondaoarinux. So let's understand the Fondaoarinux. So this Fondaoarinux is nothing but a synthetic pentasaccharide. So it is nothing but a synthetic pentasaccharide. This is the Fondaoarinux. And what about the 10A inhibition? The answer for the 10A inhibition is yes, it is present. Whereas when you ask about the 2A inhibition, the answer is no, it is not. The pentasaccharide has no action on the 2A. So this is important to note. Then moving on, what about the bioavailability? So bioavailability is, as we know, the oral, it was not absorbed in all. So it is not absorbed. Then looking at the subcutaneous is very good. So compared to the unfractionated heparin, LMWH and the Fondaoarinux, in subcutaneous of the Fondaoarinux, it is very good. Then moving on to the response. So what about the variable response? The VR variable responses, there is no variable response. Then how is it cleared? The metabolism. The metabolism, it is similar to that of the heparin, that is LMWH. It is cleared by the kidneys. It is cleared by kidneys. Next is, what about in case of the kidney diseases? So in case of the kidney diseases, so let's look at kidney diseases. So in case of the kidney diseases, it is contraindicated in renal failure. It is CI, contraindicated in case of the renal failure, it is contraindicated. Next is, let's look at what is to be done in case of monitoring. So in case of monitoring, there is no need of monitoring, it is not done. And what about the protamine sulfate antidote? And in case of protamine sulfate as antidote, here it is, there is no reversal. Then we spoke about the HIT and the osteoporosis. So HIT and the osteoporosis, the answer is it is in case of HIT risk, it is least risk. And in case of osteoporosis also, the risk is low. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.